debate, we will be arguing in favor of healthcare reform. We will show that the Patient Protection and Affordable Care Act, more commonly known as Obamacare, is a beneficial program and will help millions of people get health care. We will also argue that many of the statistics you have heard about the changes in healthcare and taxes because of Obamacare are simply untrue. Obamacare is the hotly debated healthcare reform bill that was signed into law in March of 2010. However, most of the changes will not take place until January 2014. The purpose of the bill is to provide affordable health care to millions of the uninsured. It also aims to reduce the astronomical growth of healthcare spending. The federal budget is now around $3.5 trillion. In 2010, the federal government spent $714 billion on Social Security, $283.5 billion on Medicaid, and $458.5 billion on Medicare alone. As a percent of GDP, the federal budget has grown from 9.8% in 1940 to 23.3% today. The largest growing sections of our federal budget are Social Security and healthcare programs such as Medicare, Medicaid, and CHIP, the Children's Health Insurance Program. This is due to the rising cost of healthcare and our aging population. The population continues to age at an increasing rate, especially now that the baby boomers are reaching retirement age. This contributes to the rapidly increasing healthcare costs. By 2050, the senior citizen population is expected to grow to 21%. They're living longer, but not healthier lives. This is one of the biggest problems for the U.S. healthcare system. It has mistakenly been said that 57% of doctors don't want new Medicare patients. The truth is that only 17% of all physicians said that they are restricting new Medicare patients. The reason for this is that Medicare pays them less than a private insurance company. Without Obamacare, there will be a 25% cut in physician payments. Congress has been voting to keep this at bay. However, their latest cuts will expire in 2014.
There is a myth that Obamacare has increased insurance premiums by 9%, when in actuality it has caused only 1 to 3% increase. The average growth rate in the last decade was 9%. When Obamacare is enacted, the projected growth rate is expected to be only 6 to 6.5%. These costs are increasing due to higher use and costs of care and the provisions of the healthcare law. Insurance companies aren't sure what the new costs will be, so in the meantime, they will try to raise costs extra high. If costs are lower than expected, they will drop prices substantially. One of the leading causes of rate increase is the uninsured. Hospitals are required to treat patients in an emergency no matter their ability to pay. The hospitals then have to shift the cost to the insurance companies. This results in an estimated $1,000 annual increase in premiums for insured families. Now we will talk about the effects of Obamacare. There are some important changes resulting from the healthcare bill. Insurance companies can no longer deny patients for pre-existing conditions. There is no longer a copay for preventative care. Preventative services for women are expanded, such as well visits, diabetes screenings, domestic violence screening and counseling, and mammograms. Insurance companies are not allowed to drop you if you get sick. Insurance companies can no longer limit services. Obamacare also intends to cut wasteful spending in the healthcare industry. The services that must now be covered have also expanded. This includes maternity and pediatric care, prescription drugs, and vision and dental for children. Obamacare does not increase insurance premiums. As of 2011, insurance companies are no longer able to increase premiums for the sake of profit. For a rate hike of over 10%, insurance companies have to get state approval. Under this plan, there are no death panels to decide if your treatment is covered or not. Patients will not be tagged with medical chips. You will not be forced to change your insurance coverage. The quota cost of $20,000 is an estimate for a family of 5 that makes more than $120,000 a year, not your typical family of 5. No one knows what the costs will actually be until the insurance companies start competing. Obamacare gives religious institutions an opt-out for abortion and contraceptive coverage. Federal funding does go to women's services, however, it is not forced.
How will individuals be affected by Obamacare? Well, 98% of us won't see much of a change in our income taxes. There will be a 3.8 increase on taxes for unearned income. Unearned income is interest, dividends, annuities, royalties, rents, and gains on the sales of investments. Investment properties have to be owned for less than 5 years and are taxed only if the profit is over $300,000. Individuals making over $200,000 and families making over $250,000 will also see a 3.8% tax increase to their Medicare Part A payroll tax. Most small businesses won't be affected either. Only 3% of small businesses will pay tax on profits over $250,000 and only if they have over 50 employees. They will not pay this tax if they already provide insurance. If they do provide insurance, they are eligible to receive up to a 50% tax break. How will Obamacare be funded? There are several new taxes that will offset the cost. Some of these include the individual taxes we just mentioned. There will also be a 10% increase on indoor tanning services, taxes on brand name drugs, a 2% tax on medical device manufacturers, an excise tax on charitable hospitals that fail to comply with the requirements of Obamacare, and a fee imposed on health insurers. Massachusetts has had a plan similar to the Affordable Care Act in effect for 7 years. The Massachusetts plan has seen opposition, but not to the extent that had faced Obamacare. After 7 years, the results of the Massachusetts plan are encouraging. Nearly all citizens are covered. The nationwide average is only 83%. The state plan is popular among residents with 67 to 84%, saying that they are happy and wouldn't go back to the old system. More businesses are offering insurance as well. Currently, 76% of companies offer medical insurance. The national rate is 60%. Free rider costs have also gone down significantly. Overall, the costs of the program have not exceeded expectations. 7 years ago, the expected costs were 1 to 1.5%. Today, the healthcare plan has only added 1.2% to the state budget. Now, if you can please take a look at your handout to see a comparison of the Massachusetts healthcare plan and the Affordable Care Act. These two plans are similar in many ways, but there are a few differences that makes Obamacare a stronger option. Although opposition to Obamacare has been dramatic, many of the controversial issues are unfounded. A lot of misconstrued information is being thrown about in the media. Obamacare will help healthcare costs in the long run by making us a healthier nation.